Thanks, Gail. Good morning. My name is Meagan Winthrop, and I'm a member of the senior leadership team here at LifePath Hospice. It's my pleasure to be with you this morning. I am proud to work alongside our new executive director, Grace Jackson, who joined LifePath earlier this summer. We can't wait for you to meet her. Thanks, Grace. Service is the glue that connects a community. Strangers become friends, and friends become family. My family raised me to live a life of service, beginning with my grandfather. He was the definition of nobility. As a Navy pilot in World War II, he risked it all for the people he loved and for people he'd never met. My grandmother was the first woman principal for a grade school in New Jersey. While raising 6 children, she earned her doctorate degree from Columbia University in order to better serve her students. She was also a great listener, a collector of stories. She knew no matter your walk of life, people need to be heard, and everyone has a story to tell. Sadly, she recently passed from COVID and spent her final days under the care of hospice. I hope we can all be a little bit like her today, to open our hearts and to listen. Listen to the incredible stories of the people you've helped. Stories that will continue to be told by the families we serve with your continued support. Our mission, at its core, ensures that no one dies alone or in pain. Every day, 1,110 patients receive hospice care in the place they call home, wherever that may be. It's 1 patient per square mile of Hillsborough County. While basic patient care may be partially covered through Medicare or private insurance, we serve more than 6,000 hospice patients a year, and about 8% of them can't pay for their services, which could seem like a small, insignificant number, unless it's someone you love. Thankfully, because of your generous support, last year we were able to care for 442 patients without a payment source, a total of $2.4 million in charity care. Yes, that deserves an applause. This means 442 patients ended their stories with dignity, surrounded by the love of their families and our caregivers, many of whom are here today. Caregivers that care for patient after patient, who enter unsterile houses and apartments so loved ones can be together in those final moments, months, weeks, and days. We go wherever we are called, to nursing homes and to the streets, to homes on Bayshore and homes without floors. You see, our work cannot be done by telehealth. Caring for the dying and those who have survived their greatest loss is work that requires holding hands and wiping tears, pandemic or not. And because of you, end of life is not the end of our mission. Compassionate grief support is available to surviving family members free of charge. When a mom becomes a widow, a single parent, and a sole provider, we provide year-round grief care for her children. When a guidance counselor calls us because students have lost loved ones to COVID, we go into the schools. When a company emails us that an employee has died in a car accident, we go into the workplace. We have witnessed the stories of 3,100 individuals brave enough to confront their grief. We have also witnessed your generosity in action, helping to cover $750,000 required to operate our Circle of Love Grief Center here in Hillsborough County. The center's sole purpose is to help broken hearts heal through grief counseling. That's above and beyond our $2.4 million we spend on charity care. So let me tell you about one of our most beloved patients, Mr. McCrae. Mr. McCrae grew up in Tampa and worked in the culinary industry in places you've likely been: Carrabba's, Outback, Hotel Don Vincente. Fiercely self-reliant, he prided himself on caring for himself and his family, but reoccurring cranial cancer slowly robbed him of his health and independence and eventually affected his sight and hearing. Tumors took away his ability to work, and he could no longer pay his mortgage. In early 2020, Mr. McCrae moved into a storage locker. By November, he put aside his pride and walked into our Temple Terrace office and asked us for help. Soon the hospice house became a place of respite. He found comfort and care on Thanksgiving Day and Christmas and New Year's, and on his birthday, the staff threw him a party with his favorite barbecue dinner. 64 nights of peace and a roof over his head, a clean bed to lay down his weary body, and listening ears to soothe his soul. And that was all free of charge because of you. Our nurses and home health aides not only treated Mr. McCrae's pain, but mended his heart. He has a hard time speaking these days, but he writes messages on a portable whiteboard. When we asked Mr. McCrae how LifePath Hospice has helped him, he simply wrote, "My spirit." Sorry. And Mr. McCrae is still writing his story. Today, we are caring for him at a local boarding house. He spends time with his 21-year-old daughter, Asia, when she's not working at a local bakery. And when the time comes for Asia to say her hardest goodbye to the one she loves most, LifePath Hospice will be here. We will be here with one-on-one counseling and group support, and we will be here when she begins new chapters of her life without her dad. And there are so many other Mr. McCrae's and Asia's out there that need our help. We are seeing more and more patients who have lost their jobs, their homes, and their access to medical care. We are seeing more families stretched thin, caring for aging parents and children in an economy upended by this horrific pandemic. Patients are coming to us sicker and less financially whole than ever before. The stress, as you can imagine, can be unbearable, and LifePath Hospice shows up. Each day we walk beside hundreds of husbands, wives, moms, dads, brothers, sisters, children, and friends who have no way to pay for hospice care or grief support. For every group of children you see in a Little League field or at a high school pep rally, 1 in 12 will lose someone they love before they graduate high school. For Hillsborough County, that's 38,000 children, enough to fill Steinbrenner Field more than 3 times. And this is why we need you, and we're so glad you're here today. Your generous support helps ensure we're ready to go anywhere and anytime we are needed. But there's so much more help needed. A funding gap of over $3 million in charity care and grief support remains. And frankly, we need your help to fill it, to provide charitable care for patients without funds, to help broken hearts through grief support year in and year out. Our community needs us now more than ever, and we need you more than ever. When we asked Mr. McCrae if he had a wish, he didn't skip a beat. He spoke in a broken voice and said, "I hope you have enough resources to care for the next guy like me." Mr. McCrae's kind heart is obviously forever embedded into my story, and I hope he's now in yours too. Thank you.